Anemia is a disease in which the blood doesn't have enough healthy red blood cells or hemoglobin, caused by either blood loss from injury, internal bleeding, destruction of red blood cells, or insufficient red blood cell production. Anemia can also be defined as a lowered ability of the blood to carry oxygen. There are 3 common types of anemia: anemia of chronic disease, iron deficiency anemia, and megablastic anemia. The most common type is from iron deficiency anemia. Another name for anemia is sickle cell disease, also called sickle cell anemia. This case is extremely common. There are more than 3 million U.S. cases of anemia per year. Anemia is common in the ages of 40 plus. There are approximately 5,219 deaths caused by anemia per year. Anemia is like a fever. It's a sign that requires investigation to determine the underlying etiology. It is extremely important to go to the doctor if in danger of anemia so that you can maintain healthy tissue and blood.
There are 3 different groups of causes for anemia. The first group is caused by red blood cells being lost through bleeding. Bleeding can be from gastrointestinal conditions, use of non-steroidal anti-inflammatory drugs, or menstruation. The second group is caused by decreased or faulty red blood cell production. There could be present abnormal red blood cells or simply a lack of minerals and vitamins needed for them to work properly. A few conditions of anemia include sickle cell anemia, iron deficiency anemia, and vitamin deficiency. The last group of causes is the destruction of red blood cells. Red blood cells can be fragile and aren't able to withstand the stress of the circulatory system, causing them to rupture prematurely. This can be present at birth or develop later in life. The symptoms one can experience are dizziness, fatigue, lightheadedness, or weakness throughout the body. Other common symptoms include an abnormal heart rate, brittle nails, and shortness of breath.
There are many different types of anemia, and your doctor will create a specialized treatment plan according to the cause. If you have iron deficiency anemia, the doctor will prescribe iron supplements, and you will need to eat more foods rich in iron. A vitamin deficiency involves dietary supplements and increasing nutrients in your diet. B12 shots are also needed if your digestive system cannot absorb vitamin B12 from the food you eat. There is no current cure for anemia of chronic disease. Doctors can treat the symptoms if they become severe with blood transfusions or injections. Aplastic anemia can be treated with bone marrow transplants to boost levels of red blood cells. Sickle cell anemia treatment includes administration of oxygen, pain-relieving drugs, and intravenous fluids to reduce pain and prevent complications. Antibiotics can also be taken with folic acid supplements. It is very easy to prevent getting anemia. You should maintain a vitamin-rich diet including iron, folate, vitamin B12, and vitamin C. You can also take a multivitamin to make sure you are getting all necessary vitamins. Another option would be genetic counseling. This would be a good idea if you have a family history of anemia, which could affect your future. The counselor will discuss your personal risks as well as any risks you may pass on to your children. Malaria is a common disease which can result in anemia as a complication. Traveling to a place where malaria is common is dangerous if you do not discuss with your doctor about taking preventive drugs.
Overall, anemia is the most common blood disease. Anemia can be temporary or long-term, and it can range from mild to severe. It affects more than 3 million Americans, mainly pregnant women. Living with anemia is very tough. It causes those with the disease to feel fatigued during simple activities. Although it's difficult for the body to adapt, people become accustomed to the pain. Unfortunately, there is no treatment, but as long as you have a good iron and nutritious intake, you do not have to worry. If you experience any of these symptoms, talk to your doctor immediately.